everyone, and how are you doing today? How many of you know someone who's had breast cancer? I'm here today to talk about a very important subject to me. That's not only important to me, but important worldwide, and that's breast cancer awareness. Breast cancer does not only affect the person who has it, but their loved ones that surround them. It is important to know the facts and signs of breast cancer. The reason breast cancer awareness is important to me because I've had an aunt that had breast cancer in both breasts, and she had to have them both removed. If she had done the breast exam and stuff by early detection, she may not have lost both of them. So that's why I think it's important to educate on breast cancer awareness and the detection, the earlier chances of curing it. Here are a few facts I would like to present to you. The American Cancer Society reports that about 192,000 women this year will find out that they have breast cancer. And out of that 192,000, about 40,000 of them will die of it. Breast cancer is the second leading cause of death in women, cancer death in women, right behind lung cancer. The numbers are very large and alarming, but they have been dropping down because of early detection and better treatments. Breast cancer awareness is not only for women to worry about, but men also. Though it is rare, men can get breast cancer. The statistics for men are far less than women, but they're not good. The American Cancer Society states that about 1,900 men will find out this year that they have breast cancer, and about 440 of them will die of breast cancer this year. Even though it's 100 times less than a woman to get breast cancer, it's still a possibility. Now that I've gone over some of the statistics of breast cancer, I would like to talk about what breast cancer is and the symptoms to look for. Breast cancer is a malignant cancer that forms in the breast cells. Here are some of the symptoms for breast cancer. Swelling of all or part of the breast, skin irritation or dimpling of the breast pain, nipple pain, or nipple turning inward, redness, scaliness, or thickening of the nipple or skin, and nipple discharge other than breast milk. One of the most known symptoms of breast cancer is the lumbar mass in the breast. It is not known what causes breast cancer, but there are some risk factors that contribute to it. The obvious risk factors are smoking and drinking and a person's diet. Even though a person may have these risk factors, doesn't exactly mean that they'll get breast cancer, but their chances increase. The risk factors that I just mentioned are controllable, but there are other risk factors that cannot be controlled, such as age, family history, or race. There are no known preventions for breast cancer, but you can reduce some of the risks. Maintain a healthy diet, limit your alcohol, and don't smoke. The best defense against breast cancer is an early detection. The first is doing a self-breast exam. This is where the person does an exam on themselves to see if there are any lumps or changes in their breast. Everyone, including men, should do this on a regular basis. The next is a clinical breast exam. Women in their 20s and 30s should do this at least every 3 years. A clinical breast exam is done by a health expert and is performed the same way that a self-breast exam is. This is actually a good time for someone who doesn't know how to do a self-breast exam to learn. A mammogram is recommended for women over 40 to have done once a year. A mammogram is an x-ray of the breast. There are two types of mammograms. One is a screening mammogram, which is used for women who don't show any signs of breast cancer. They're just getting checked out. The other is a diagnostic mammogram, and it is used when a person has noticed one of the symptoms of breast cancer on them. All of these techniques for detecting breast cancer are recommended as well for men. The best defense for breast cancer is you. If everyone would just take these suggestions and use them, the better chance of detecting breast cancer early and curing it. Please take what you've learned here today and share it with others to help with the fight against breast cancer. I would like to thank everyone for their undivided attention. Thank you.
Woo!